Welcome people. Now we have reached this stage, very important one. Antibody detection, Widal test for enteric fever, typhoid. Widal test. This has been asked so many times that if you know it, like definitely you will get 5 marks. Right? That kind of question it is. It is asked so many times, you have to know it. Now let's dive into this question, Widal test. Widal test is detection of serum antibodies. Okay. Let's make a new slide here. Widal test. You're detecting serum antibodies. Okay. It is one of the oldest and most widely used serological tests for diagnosis of enteric fever. Diagnosis of enteric fever. Okay. Moving on, it was discovered by Fernand Widal in 1896. Discovered by Fernand Widal in 1896. Who discovered Widal test? Widal itself discovered Widal test. Principle. It's an agglutination test. This, you know what we use. What antigens we use? O antigen of S. typhi, H antigens of Salmonella, Para-Typhi, A, B we use, and O also. H antigens of all these we use. S. typhi, Salmonella typhi, Salmonella Para-Typhi, A and B. Okay. So the antigens used are O antigen of Salmonella typhi, that's called as TO. H antigens of Salmonella typhi, that is called as TH. Correct, no? Then you have H antigens of Salmonella Para-Typhi A. Those are called as AH. And H antigens of Salmonella Para-Typhi B. That's called as BH. Okay. Typhi O, Typhi H, Para-Typhi AH, Para-Typhi BH. Okay. So you are going to check the agglutination of antibodies and antigens. Okay. What are the antigens? These are the antigens. These are ready-made antigens you will have. Ready-made antigens you will have. Then the patient's serum you will add. Patient's serum should have the antibodies. And if the antibodies are present in the patient's serum, it will agglutinate. Hence, your Widal test will show you what kind of infection it is. Okay. Let us try to interpret the result. Okay. Now, let us just look at this. This is a slide. They have done it on a slide. It's not very precise. Okay. When you do it on a slide, you should actually do it in tubes. But let us say slide you have done as a screening test. And you can see that O antibodies are present. Okay. So, O agglutination will be there. So, TO has agglutinated. That means it can be anything. It can be Typhi, Para-Typhi, A or B. That is because I think they are using 12. 12, if you have seen, this O12 is present in all the 3. Do you remember that table? This one. In this, if you can see, in A, B and Typhi, 12 is common. Right? So, if you use that, definitely you will get TO rises, means either some infection, typhoid or paratyphoid, something this guy has. Okay. Now, if TO and TH increase, then it is definitely Typhi. If TO and AH increases, definitely Para-Typhi A. If TO and BH increases, definitely Para-Typhi B. No doubt, this much 4 are clear. Correct? Now, 2 strange things are there. If a person has all more, TH, AH, TB, everything, all the H's, then he has a vaccination. Okay. Now, what if only TH rises, there is no TO. So, TO has gone and TH is there. That means you remember we had studied that O is early to come and early to leave, but H will be late to come and late to leave. So it means to say that person is in a convalescent stage. Okay. Or it could be an anamnestic reaction. That means enhanced reaction of the body is immune to an antigen. Don't bother much about those things. Remember this much. If it is only TO, that means it could be anything. H hasn't appeared yet. Only A has come. It's a recent infection and we still don't know whether it is Typhi or Para-Typhi. Now, if O and H increases, it is definitely Typhi. If it is O and AH, definitely Para-Typhi A. O and BH, definitely Para-Typhi B. And if it is only H, all the three H's are present, it is a vaccination. And if only TH is present, that means to say that it is a convalescent stage. This much you understood, right? Very good. Let's revise Vidal test. It is for detecting the serum antibodies, especially used in typhoid fever, diagnosis of enteric typhoid, paratyphoid. It was discovered by Vidal in 1896. The principle is agglutination test. Antibodies and antigen agglutinate. You have ready-made antigens for these. Okay, sometimes they could even be bound in these plates and you can just directly use it on them. So, O antigen of Salmonella typhi, H antigens of Salmonella typhi, H antigens of Salmonella paratyphi A and H antigens of Salmonella paratyphi B. And this is the interpretation of the test. Details of how to do this test. Actually, there is tube also. If you see this photo, tubes, right? Slide is there, tube is there. You should know how to do the slide and tube. Slide is very simple. You can just put O here, O antigen here, H antigen here, AH antigen here and a BH antigen here. This will be a negative control and this will be a positive control. Negative control will not have anything. Positive control should have the, you should make it agglutinate. So you should add antibodies which actually will agglutinate also. So this will be a comparison for you to check the agglutination, positive control and negative control. Pathogenesis of Salmonella typhi. Whenever we are talking, we usually talk about these four only. So don't think that it is the entire Salmonella we are talking about. We are talking only about the enteric fever causing Salmonella. That is Salmonella typhi, Salmonella paratyphi A, B and C. That is paratyphi A, paratyphi B and paratyphi C. All these will cause enteric fever. Now what is enteric? Anything that is related to the intestines. Okay. Got it, right? Now this is transmitted by oral route. So if you possibly consume food or water that is contaminated, you might get typhoid. Now these are the bacteria and they will go and affect what? Your intestines. Okay. Let us look at the risk factors now. Who and all are susceptible to typhoid? See, people who have less acid in the stomach. Why? Because the acid has to kill the bacteria, but if there is less acid in the stomach, the bacteria can reach the intestine, correct? Now when who has less acid in the stomach? An infant or a person who has taken antacid. So that person is risking himself to typhoid. Now one more thing I forgot in the previous slide here. Infective doses minimum 10 power 3 to 10 power 6 are needed. Okay, so 10 power 3 means what? 1000. You need at least 1000 Salmonella bacteria to come into you. Okay, 10 power 6 is again 10 lakhs or something, I think. So that much is required for, just remember, at least 1000 bacteria should enter you. Okay, so we are moving on to the next slide here. That is risk factor. Now risk factor, we told you, if there is less acid in the stomach and intestinal integrity. Now that the bacteria reached the intestine also is not, intestinal integrity is not there, right? It's not integrity, it should be integrity lost. Like inflammatory bowel disease is there, any prior GIT surgery is there, the person is on antibiotics, so the normal intestinal flora is suppressed. So all these things can cause typhoid, okay, enteric fever. Typhoid is a type of enteric fever. So let's move on now then to the next slide. Now how does the Salmonella enter or invade? How do these bacteria enter our body? So now what happens, it is going to enter through the epithelial cells or the M cells, okay, and they are uptaken via bacteria mediated endocytosis, BME. Just learn more about these. So the first step here, entry through epithelial cells, M cells, lining the intestinal mucosa. These epithelial cells are lining the intestinal mucosa. The Salmonella trigger the formation of membrane ruffles on the cell membrane of M cells. These ruffles reach out, enclose, and they take in the bacteria within large vesicles. So the epithelial cells, the membranes, the cell membranes, they ruffle and they reach out, they enclose the adherent bacteria and they uptake the bacteria. This is bacteria mediated endocytosis. Now what happens, the bacilli, they remain in the vacuoles of the cytoplasm. Okay, let me write here. After the endocytosis, their bacilli remain in the vacuoles of cytoplasm. Okay. Now what will happen, macrophages have to come, right? Now these epithelial cells which are containing these vacuoles which contain Salmonella, they reach submucosa. Okay. Here what happens, they are phagocytosed by the macrophages. Now these macrophages come in now and they are trying to dissolve these epithelial cells which contain the Salmonella bacteria. Now these Salmonella are very smart, they go and start surviving within the macrophage also. Okay. But the Salmonella survive the intracellular killing and they survive within the macrophages also. Till here have you understood? So the Salmonella actually is very, very smart. See how smart they are, right? They enter the blood, they cause bacteremia, transient primary bacteremia. Then they disseminate through the reticuloendothelial tissue, that is the liver, spleen, lymph nodes, bone marrow, and they even reach other organs, gallbladder, kidney, lungs, etc. Okay. Secondary bacteremia occurs from the seeded organs. Okay. From these organs again it goes back to the blood and causes secondary bacteremia. Please get up if you are sleeping. We are talking about primary bacteremia, and then it goes to the organs, gallbladder, especially it loves to divide in gallbladder because it loves bile. Okay, it goes to gallbladder, liver, lungs, kidney. Okay, liver, gallbladder, kidney, lung, it goes to all these places. Okay, and then it causes secondary bacteremia. Okay, is this much clear to all of you? Very good. So this was the pathogenesis. Let me tell you finally what it causes. It causes enteric fever like typhoid and paratyphoid. Paratyphoid and typhoid are types of enteric fever. Typhoid is caused by Salmonella typhi. Paratyphoid is caused by Salmonella paratyphi ABC. It causes septicemia, gastroenteritis. Okay, shall we move on now?